Hi, my name is Dr. Anitha Iyer. I am the Director of Behavioral Health Population Management for Mount Sinai Health Partners. Yeah, I mean, COVID has been really something we've never seen before, right? It's almost like the hurricane that won't go away. And I use that example because mass disasters are really the only analogous experience that we have to compare from. Except, in any situation of a mass disaster, you have the incident and then it goes away and then you can sort of focus on rebuilding. With COVID, the whole globe really has been reeling from it and adapting and experiencing sort of resurgences and such. And so it's really been this ongoing trauma. In addition, there has been sort of the unexpected, unplanned effects of all of the pain that shelter at home and quarantine orders and school closures have caused. So, financial challenges for folks, for providers, the need to quickly adapt and scale up new protocols, new procedures while supporting their patients, while going out there and treating folks with COVID and worrying about their own health and the health of their families, for patients not being able to access care in their providers' offices in the way that they can expect. And then sort of not knowing about whether, they will have their job once the closures are lifted, not being able to pay their bills while they're not able to go to work. Even if you received, financial aid or sort of the relief package from the government, perhaps that was not enough to make ends meet. And then on the school closure side, parents having to adapt to working from home while simultaneously having to watch their kids at home and support them at school. So all of these are really chronic. They've become chronic stressors, and they are all together sort of this package of complex trauma. So mental health consequences of that are completely expected. I mean, we would expect human beings to respond to all of these stressors with increased depression, with increased anxiety. And that's what we've seen. Surveys that the CDC has done, surveys that the American Psychological Association have done, national surveys with large samples have found that rates of depression since April have been about 30%. And rates of anxiety among people surveyed have been about 30%. That's about 3 times higher than equivalent time periods in 2019. Similarly, stresses about finances have been significant since the pandemic began, since about April and May. The last time we found the same levels of anxiety about finances was in 2008, right after the economic collapse at the time. So people are on edge and they're really experiencing significant mental health strains. And I think health systems are starting to anticipate that even after the medical effects of this pandemic are over, we're going to be living with the psychological effects of this in our populations for a long time. Crises don't come sort of announced on a schedule. People have needs when they need them. So, if someone, whether or not they're connected to care, has experienced a really big setback, and if they have some underlying chronic mental health conditions, and they're sort of dealing with suicidal thoughts, that one stressor may be the tipping point. It may be the thing that sort of pushes them over into the place where they feel totally hopeless and they feel like they are a burden to other people. Often those two pieces, when they come together, is when people start to think actively about their suicidal thoughts. And so, if that happens in the evening or overnight hours, when the person's regular provider is closed, it's outside of business hours, what is a person to do, right? And so technology really becomes key. It having the access to either public hotlines and text and chat platforms, or even customized solutions that healthcare systems can build for their patients to use to reach either on-call clinicians or maybe partnerships between a healthcare system and a provider that has on-call clinicians that are available around the clock. Those sorts of opportunities, which allow people to really have suicide safety in the palm of their hands, are really important and powerful pieces of suicide prevention as we move forward. Really, seeking support for safety planning through your suicidal ideation and connecting with care, whether it's emergency services, if you're experiencing acute active ideation, or planning for safety and knowing, scheduling an appointment, knowing what resources are out there, and just receiving sort of in the moment counseling. That should be as easy as it is for us to now order a cab or, order a meal. We have to work to make the system respond to the need and bring the care to people when and where they need it, rather than continuing to expect people to schedule their needs in accordance with what our brick and mortar systems can provide. We know that there are warning signs, there are risk factors that place people at higher risk for suicide. We know that suicide is preventable. We know that for every person that dies by suicide in the United States, about 280 people seriously think about suicide but don't go through with those thoughts. So we know that this is not something we need to sort of sit on the sidelines and watch. And given that we know the kinds of factors that predict the likelihood for someone to die by suicide or attempt suicide, we can plan for those. We can look at primary care as a resource where people are already engaged with their primary care providers. What kinds of mental health screening and interventions can we make available in the settings that people already are? How can we screen people for suicidality in these settings so that we can start to work towards suicide safety before the person is in a state of crisis? Similarly, other settings that people are engaged in on an ongoing basis. Partnerships between healthcare systems and community-based organizations that are perhaps, helping individuals work through their legal needs or their housing needs or their food insecurity needs. How can health systems and those sorts of organizations partner in setting in place appropriate channels for people to share emerging crises so that we can collaborate in patient care, ensuring that we can step in and support them, like I said, before a crisis unfolds. So prevention is always better than cure, as the old adage goes, and that certainly applies to suicide prevention as well. That's a great question, and I'm glad you're asking it. I think we keep talking about stigma, right? We keep talking about, people don't seek mental health support because of the stigma, because they don't want to be seen going into a psychiatric clinic, because they don't want family members to know that they're seeking therapy. It's somehow something's wrong with you if you need therapy. We don't have those same attitudes toward, going to see a primary care physician because your arm hurts, or going to see a primary care physician or a cardiologist because your chest hurts. We're more comfortable talking about, heart failure than we are about mental health needs. We talk about stigma, but the process for breaking that down and the process for encouraging and empowering people to seek mental health care is that we have to lead by example. And so I think really the shift in the conversation has to include people speaking people at all levels, not just sort of patients, but providers, public figures. And we're seeing a lot of that, right, more recently, speaking openly about mental health struggles, normalizing that, making it sort of okay to experience feelings of depression, feelings of anxiety in response to stressors, reminding people that, feeling sad when something terrible happens to you is a pretty predictable, reasonable human response. Feeling anxious when you're worried, feeling anxious right now, that what's going to happen when schools open and if there's a resurgence in cases and they close it down, it's a reasonable worry. Feeling depressed because you're isolated, you're not able to connect with your friends, you're not able to have birthday parties and wedding ceremonies, it's reasonable to feel that way. And then reminding people that, there are some points when our reasonable emotional responses can become prolonged or can become more acute, such that it's impacting our functioning. It's making it hard for us to take care of ourselves, go to work, wake up in the morning, eat, bathe. And it's, interfering with our ability to be our whole selves, and to recognize those points in time and know that that's when you should seek professional intervention. If we begin to speak and exemplify that kind of a message, normalizing mental health response, I think that would be an important step in shifting the conversation around mental health and really ensuring that people pursue healthy mental spaces and healthy mental lives.